Hello, everybody. Mark Rogers here. We are coming in a little later in the week, and that's because I lost my voice. It is fall time frame, and I lost my voice over the weekend, but we wanted to still bring in hot information. There's interesting Medicare stuff going on right now that we believe we need to share with you and give some analysis. And the only way I can do that is to bring my co-host, Leith. Leith, welcome. Thank you.
Morning. Morning, everyone. It's a beautiful day here out and the sun is out. I hope it is for everybody else because it's a great day.
And we're wearing our sweaters now. It's sweater weather.
Weather.
Sweater weather. Yeah. So anyway, we're running late, but we wanted to get this information out to everybody. If you've got any questions, folks, if you got any questions about stuff, drop it in the chat. We'll see that in the chat as we go along. Certainly subscribe, share, Talking Turning 65. That's where we are over on Facebook and YouTube. And we're trying to unpack things a step at a time. We certainly, if you got the Medicare and U book in front of you, make sure that you got you dig through that Leith quite a bit, and we can Leith. Yeah. Yeah. And we always tag through it, right? So everything we're talking about, we're trying to pull it through this book where we need to, where we can. We're going to go ahead and give you the page number of where that is. But right now, we want to be able to talk about, we got some hot news here, folks. This is incredible. We've been talking about Medicare Advantage plans, and we just pulled this up out of Rochester, Minnesota, with regards to Mayo Clinic will be out of network for certain Medicare Advantage plans in 2026. This was published October 22nd by Grant Jones over there. And here it says, starting in 2026, the Mayo Clinic will no longer be in network for certain Medicare Advantage plans from two of the country's largest insurance providers. United Healthcare and Humana both confirmed they would not provide certain Medicare Advantage plans for Mayo Clinic patients starting January 2026. Isn't this something, Leith?
Yes.
Talk to me.
I was shocked. Somebody told me it, and I said, what? So I had to go look it up, and it's like, oh my gosh, I couldn't believe it. When we talk about Mayo Clinic, Mayo Clinic is Mayo Clinic. They're so well known. And that's just.
Especially, Leith, when you're having a medical situation, the last thing you want to go is, I want to go to the best, if you will, and to now be able to go, oh, I'm limited to where I can go. But just to continue on here, it says, we have reached a multi-year agreement that provides continued network access to Mayo Clinic for people enrolled in United Healthcare employer-sponsored plans and Medicare Advantage group and retiree plans. However, starting January 2026, Mayo Clinic locations in Minnesota, Wisconsin, and Iowa will be out of network for United Healthcare's Medicare Advantage individual and dual special needs plans. Just let that sink in, folks. That is incredible. Medicare Advantage members who want access to Mayo Clinic should review their options during the upcoming Medicare enrollment period. And I tell you what, Leith, I've always been a big advocate of going to the best. And I know I've been to the Cleveland Clinic for a relative. We went there for a heart situation, but to be able to go to Mayo Clinic is a big deal. And now when Medicare Advantage plans are starting to cut where they're going to be like that on big plays, it's a sign of the times coming.
Just in an uproar right now. I don't know how else to put it. We just hear something new every day.
We do.
About
what's happening. Yeah. And that's why we believe in Medicare supplements, because Medicare supplements don't have that restriction. Wherever someone is going with Medicare, they can take a Medicare supplement plan with them. The thing that I wanted to bring out is out here in the eastern counties, these eastern Oregon counties, these folks that have had Medicare Advantage plans are going to be losing Medicare Advantage plan options. And so that's why there's actually a unique opportunity right now to find yourself a good Medicare supplement that's affordable, that gives you the care you can. There's an opportunity. I've done this with folks before where we're able to grab a hold of a Medicare Advantage plan when your Medicare Advantage plan is leaving the county. Now's the time to see if you can jump on a Medicare supplement and put that all to rest so you don't have to mess with it. I've helped people, this is probably 7 years ago, I helped people that had sicknesses like some dementia, a dementia case, and some dialysis situations. And there is that opportunity when that Medicare Advantage plan is leaving. Now's the time to be able to jump over and get yourself a Medicare supplement.
Mark, so just to confirm for people, when a Medicare Advantage leaves the area, you have the right to go to a Medigap supplement plan.
Absolutely. It's a big deal. It's a big deal.
It's a big deal because normally you just can't, if you've got a Med Advantage plan in your area, you go to another Med Advantage plan, but in those outlying areas, there are very few Med Advantage plans.
And
I mean, there's just not that many options.
Right. And so I know an agent, we're going to have her on here this next week. She's up in the Northeast or Oregon County area. And that's what she's doing right now, is helping these ones because they just don't have that option. And so this is a great opportunity to be able to get a hold of a solid plan. And that's why we work with people. We want to make sure that everybody's set with their healthcare plan, going to the best they can go. Don't have to worry about Mayo Clinic. Don't have to worry about Cleveland Clinic. Don't have to worry about Seattle or the Spokane Heart Institute up there, is to be able to go where they want to go, not messing with the network. Anyway, let's move on real quickly here. Leith and I have talked about something called the House of Healthcare. And I want to talk about this really briefly here. Folks, when you're building your House of Healthcare, make sure you know how to build it. And we're going to start in the lower left-hand corner there, your Part A hospitalization card. If you look at your Medicare card, make sure you see that hospitalization. That is critical to understand where your gaps are there. And then moving up, we build on top. You build on that Medicare Part B. That's your outpatient care. Up on top of that is your Part D. This is the time of year that you should be able to do that, where you're actually looking at Part D cards. Again, we're advocates for Medicare supplement plans. And so that would be on the right-hand side down, funning around there a little bit. In the Medigap Medicare supplement, that's on the right-hand side. You're building that with a solid supplement plan. And then you may attach a dental, vision, hearing plan on top of that. And then some people, and there's great options right now for cancer, hospital indemnity. There's lots of expenses associated with cancer treatments and hospital indemnity when they're in the hospital. And there's just expenses all over the place. And so you want to see if you can get maybe some additional coverage. And so it all packages together. We all want to make it fit in the budget on that. Now, down below, there's a foundation. The foundation is custodial care. We're not going to go into that right now, but your home care, facility care, Medicare, folks, does not cover that. It's important to understand Medicare does not cover that. That's the foundation. That type of expense will unravel your own budget if you do that. Leith, take it to the next slide. Let's move on.
Okay.
Now So we have right now, this is out of your Medicare and U book, by the way, folks. So jump over to your Medicare and U book. We just pulled it from there right now. Page 13. Page 13. And this is where you can go. We're going to bounce right there, and you can find it right here. And that's page 13, folks. So where we're looking at right now. But let's go to right here. This is October, the second bar down, October 15th through December 7th. This is the time that if you have a situation where your Medicare Advantage plan is leaving, you do have the option to pick something else, a Medicare supplement. Come January 1, though, if you find yourself difficult with your prescription drug plan or Medicare Advantage plan, there are going to be limitations January 1 through the 31st for that type of thing. Leith, my voice is giving out on me, so I'm going to try to go to the next slide here. Medicare Advantage, folks, just want to touch base on this really quickly. These are the plans this is what's all the question marks are across the country. And if you've got a Medicare Advantage plan, know that your limitations are there for your networks. We just talked about the Mayo Clinic. We just talked about that. But there's other clinics locally that are not taking it, will take it. Bend, Oregon had a problem here this last year ago or something like that, major debacle down there. You have to have prior authorization requirements. That's part of that managed care situation. There's some higher cost for some services. Listen, yesterday, Leith, check this out. Yesterday, I talked to a gentleman here locally, and his wife is sick, and they have a Medicare Advantage plans. He went into the hospital, or his wife went in to do two different services, outpatient. He stroked a check, $1,500 per visit.
What?
Yes. And he's like, I guess I'm good with that. I'm like, really? You're good with that? On a Medicare Advantage plan. And then there's some billing issues and things like that. But it's like they charged him, and I think it's out of network, but it's a big clinic out of network that they hit him up with that $1,200 or $1,500 per visit. And I thought, wow, there's better you can do to that.
That's a lot. It's got to be out of network.
Yeah, but it's
not. Who knows?
But it's a big, huge hospital network locally, and he's just down the way a little ways, and that's where they were having that major testing going on. Out-of-pocket maximum can be $5,000 or more. Folks, check your Medicare. If you like your Medicare Advantage, make sure you check that, because if you end up having a bad year and you're stroking checks, do you really want to go that high? And that's going to be in the fine print. Travel limitations are there. And listen, it is harder to get back to a Medigap at a later date. If you have health issues, that is going to be a problem. And this guy, he would love to have his wife on a Medigap plan, but she's got issues, so we have to go through underwriting. But this is different. If your Medicare Advantage plan is leaving, you can get on a Medicare Supplement. And the complexity and hidden rules and everything from there. So just be careful, folks. Your max out of pocket, your network, and the fact that it changes every year. We see these changes. Be very careful. This is the time that you can make that opportunity there. Take it to the next one, Leith.
Okay, we're going to go on to Medigap Medicare Supplement. So what are the features of that? You have lower out-of-pocket costs. So you may not have a scenario that Mark just talked about when you go to the hospital. You have freedom to choose a Medicare-approved provider. So you can go to any doctor that takes Medicare, period. You don't have to worry if they're on a plan or off a plan. You've got coverage while you're traveling. Your costs are predictable. You know what your monthly premium is. You know what Medicare's gap is going to pay that Medicare doesn't pay. So you can really predict your costs for that year. It's guaranteed renewable, meaning every year it just renews. You'll get a letter from your insurance carrier that you purchased your plan from. They'll tell you it's renewing. And that's it. It works seamlessly with original Medicare. So what happens is if you go in for services, you have the services. The provider bills Medicare first. Medicare is your primary. And then once they pay, then your provider bills your secondary, which is your Medigap supplement plan. They do it all. You don't have to try to bill, figure out what to do. They do it.
And I want to just bust in there, Leith. And I had a client call me, and it's very clear when you go in, make sure you got your Medicare, your red, white, and blue card, and your Medicare supplement card. Hand both of those to the billing, because all the billing is going to have to go to Medicare first, and they will also bill the supplement. The supplement will pick up the balance of it. If you've got something in addition to that, why, that'll be on you, but make sure you have both cards. I just want to clarify on that, because I just had someone come in with that.
Yeah. And then the last thing is no prior authorization, except for there are new rules in for 2026 that there are some diagnoses that they're doing a pilot program in 6 states where these particular diagnoses, you have to have prior authorization. And we talked about that in an earlier video. We'll be talking about it again throughout our podcast. But that's one of the great things about the Medigap plan is, whereas Med Advantage plans, lots of times you have to have prior authorization for just about everything.
That is exactly right. Yeah.
You have to be in network.
Yeah.
Right? You have to make sure you're in network. So,
yeah,
if you're on the way in an ambulance, how do you know which network you're?
Like you said last time, Leith, as you were headed out to on the ambulance, you were concerned about which network you're going to be in.
And it was just comforting that I had switched and, I don't have to worry about that now. Just take anyone.
I had to persuade you to switch to a supplement.
Was that great past employer plan that I couldn't get out?
Yeah.
Okay. So let's talk about how Medicare Part A works. Some people know this by heart, but we're just trying to give everybody the information. So Part A is your hospital insurance. That's your inpatient hospital insurance. So inpatient care. They also have under Part A, there's a skilled nursing care benefit of 100 days in a facility. So let's say you have a serious health condition, you're in the hospital, you have surgery, maybe you have heart surgery, you don't have anybody at home to take care of you. You can go to a skilled nursing, or they call them rehab facilities now, for your rehabilitation to get you ready to go home.
And I want to make sure, and this is important on that skilled nursing. This is bullet point number 2. Right. Is Medicare, original Medicare is only going to take care of that first 20 days.
Right.
From 21 to 100, there'll be copays on original Medicare. We're talking about original Medicare here.
Right. Yeah. Thank you, Mark. Next one is hospice. Part A does cover hospice care, and then they cover home health care. So home health care is in your home. Let's say, for example, you had some sort of surgery or something in your home. They may send out a rehab therapist to do a review of what your needs are. Do you need help with this? Or do you need to go to physical therapy after you've been home for a while? You can get that type of evaluation, and that's what falls under.
But I think, Leith, if I'm not mistaken on that, since Medicare is a skilled care type of system, that you got to have some kind of premise of getting better to have that home health care. You got to have some kind of getting better. Conversely, the one above it, hospice care, says that you're going to pass away within 6 months as diagnosed, and that's hospice care as I understand it as well. It's very good to understand Medicare Part A and get a hold of this, folks, because there's a lot of hidden things along the way, and we're trying to plug holes along the way. And you may think your Medicare Advantage plan may do it. Well, it may change on you, may not do it so much. And some people, to Leith's point, home health care are surprised that custodial type care is not going to be covered over there.
Part B, what's Part B? So Part B is outpatient. Part A is inpatient. Part B can also cover hospital visits as long as you are not admitted. Correct, Mark?
Big deal. It's a big deal. Make sure when you're in the emergency room, you may not be admitted. You're under observation. Therefore, you're outpatient. You can rack up big costs in original Medicare this way. Or in a Medicare Advantage plan, you may rack it up as well if the outpatient stuff isn't covering that. So it's a very big deal on that.
So what else does Medicare Part B cover? Medically necessary doctor's office visits. Okay. Preventative services and screening. So in your Medicare book, in the very first pages, under the section with Medicare Part B, it goes through a list of all of the preventive services that it covers. Okay. There's what do I want to call it? There's an apple next to things that are preventative services, I believe.
Yeah, so when you thumb through here.
If you thumb through that book,
yeah,
there's a legend, and it tells you, and it's really clear what's covered in all preventative services and screenings.
Got it. Great. Thank you, Leith.
And then outpatient care. It also covers outpatient care. So like Mark was talking about, outpatient in the hospital, that's outpatient care. It covers some home health care. In the book, in the Medicare book, I'm not going to read through the paragraph, but it does describe what they mean by some home health care. Durable medical equipment, those are things like crutches, wheelchairs, walkers. What else? Anything to assist you with whatever that medical diagnosis is.
Right.
Mental health services, it does cover mental health services. And there is limited outpatient prescription drug costs. I put the page on there, which is number 39, because it's very helpful to have that information if you're concerned about some sort of outpatient prescription drug cost. And then again, pages 30 to 55 in your Medicare and U book, that is where you can find the information about the Part B outpatient services. And they go through it pretty extensively. It's a really good explanation of what is covered.
Excellent.
You want to add anything, Mark?
No, just to sum it up, I just put this all up here is, frankly, folks, your Part B is going to be everything that is going to be doctors, testings, therapies, and treatments. It's as easy as you can get. Doctors, therapies, testings, and treatments. All that stuff is a skilled care thing, and that's where you have to just know, that's as simple as outpatient gets. Doctors, testings, therapies, and treatments that are going on outpatient.
Okay, so I've gotten questions from some of my clients. It's like, when I talk to them about the Medigap plans, is how does it work? How does it get billed? What do I have to do? So this is just a little graph of what happens. So let's say you go in and you have a service from a provider. You give the provider, as Mark said, you give them that Medicare card and you give them your Medicare Supplement card. The provider bills Medicare first. Then Medicare pays the allowable charges and after any deductibles. So it's the allowable charges. What does Medicare? So let's say, for example, you have a service for $1,000. The provider sends a bill to Medicare. Medicare sends back an explanation of benefits saying, we feel that this service that you received is worth $800. So Medicare pays on the $800. The doctor writes off the $200 of the non-allowable charges. Make sense, Mark?
Yeah, and in fact, let me just put it up here. So basically, what was your expense again? Let's give me an expense.
Let's say my expense is $1,000.
Okay, here's $1,000. Okay, this is the billable amount. Okay,
correct.
Billable amount. Yep.
I've got the doctor is billed $1,000.
Yep.
Medicare says we feel that $1,000 service is worth $800.
Yes. So we're going to go 800, and this is called a Medicare allowable. Okay.
Correct.
Okay.
Let's use the example that this is an outpatient service.
Yes.
So you have to meet your Medicare Part B deductible. I think for 2025, it was 200 and.
Yeah. Let's say they already did that. Let's say this further on in the year, they already met their Part B deductible of $250.
Part deductible.
Yeah.
So they met the deductible. So Medicare says that the service is worth $800. Medicare pays 80% of that $800.
That's right. Yep.
And then provider writes off the $200.
Yep.
The provider bills your Medigap plan.
Yep.
For the remaining allowable charges. Your Medigap plan pays the remaining balance of charges, of allowable charges.
That's right.
Okay.
Okay. I hope this makes sense. Does this make sense on the screen here? It's 80%. Medicare's paying 80% on the Medicare side. Medigap plan will come in and pay the 20%.
Correct.
Good.
Easier way to say it.
I'm a visual person. I got to see it. I know.
Okay. So that's really about all we have today.
That's all. Yeah. It was a good, I want to do one other thing here before we jump here, Leith. I just feel let's throw back to here. I want to go back to this for just a second. So I want to go back. Well, I'm going to give folks our options, right? Okay. So if your MAPD is going away, okay, then you can see if you can scramble to another MAPD, or you can go over to a Medicare Supplement plan, which is original Medicare plus the supplement. All right. If you are on an MAPD and you go, you know what? I'm tired of the circus. I want to see if I can get a Medigap plan because I don't want to have networks. I don't want to be messing with this every time. Then what you have to do is you have to go first. This is where we work with people, is you may have to be underwritten just a couple medical questions on a med sup plan. Okay. When you are underwritten on a med sup, if it comes back as a yes, you're good to go. We should know that in about a week or two. Then you would go to original Medicare. You say, all right, I'm going to go to original Medicare. Okay. And I'm going to have my supplement. And I sign up for a Part D card. And those Part D cards, there's a lot of inexpensive Part D cards out there today. So in essence of this all, at the end of the day, you'd have a Part D card, you'd have your supplement card, and you'd have original Medicare. That's how people are able to get out of the MAPD thing. Does my scribbles help, Leith?
Yes. MAPD is Med Advantage with plan.
Exactly. It's all combined together. But if you want to break it apart, you want to unravel it, not have a network, not have to mess with this every year, then you're going to want to, we would have to go possibly, if your plan's not going away, go back to underwriting. Not a big deal. Leith and I can help you with that. Go to underwriting, answer a few questions. If the insurance company takes you on, great. Then you would be able to go on original Medicare, roll into a supplement and Part D to combine that. Therefore, in my opinion, this is my opinion only, this is to me a foundation that is secure. It's secure and it gives you control, because every year the only thing you have to work with is maybe looking at this Part D, real minor thing. I have so many clients that are happy on their supplement plan. They are happy on their supplement plan, going where they want to go, not having to mess with things.
I just want to add too, since we're in the enrollment season, people are getting phone calls, getting inundated with mail, and a lot of it talks about Part C.
Yeah.
Part C is your Med Advantage plan. Okay. So what the government did is they rolled it all up into one and called it Part C, which for some people is confusing. If you've never, I've got some really elderly people that they get this stuff in the mail and they call me. It's like, what's Part C? Do I have to have Part C? Do I have to sign up for Part C? And it's no, you're good. So just remember that if you get the phone calls and the mail and the 1-800 numbers, we're proponents, obviously, working with an agent to help you work through all of those scenarios. So
it's exactly
really with the 800 numbers, the 1-800 numbers are.
Yeah. Now there's real scams going on, Leith. We're hearing it. The government's worried about it. We've got real problems with these scams coming on. So we have to be very cautious of that. Yeah.
Especially if they call for your Social Security.
Yeah.
You can see if you're on this and that. Yeah. Don't hang up.
Hang up. Yeah. Yeah. I think it should be a wrap today. If you have questions, we're going to put Leith's information down in the chat as well. But before we do, we want to make sure that everybody knows we are streaming live, if I don't lose my voice, we're trying to stream live on Monday mornings, 9 a.m. or 10 o'clock. Be like the coffee shop guys. Don't be down to the coffee shop guys trying to spit things around. Got to get the facts, right? But also, subscribe the channel. So you got Facebook and YouTube going on here. Like and subscribe it, but also know the fact that also over on Zoom, we actually run a private office hour at 10 o'clock our time, 11 o'clock Mountain. Those are a bunch of ladies that are talking on the trail. You know what? Don't be out there talking on the trail about this because you may not know what you're talking about. So let's jump over onto Zoom private. Leith and I are in the private Zoom at 10 a.m. on Mondays. And you got that registration there, tt65officehour.com, tt65officehour.com. Anything further before we jump, Leith? Anything further?
I think that's about it, Mark.
Let's just help them.
This week.
Yeah, for this week. We got more stuff. We got a new guest coming up this next one. So let's be fun on the next one. Got a new guest. She's been a nurse for many years, recently converted to helping people run Medicare. Really excited to bring her, introduce her to everybody. All right, folks, we're going to jump. We will see you next time. You got Leith's information, my information down below. We'll see you on the next time. Subscribe, share. See ya.
Friends, we've reached the end of our 30-minute journey on Talking Turning 65. I hope today's conversation shed light on the challenges and opportunities you face as a rural retiree in the West. See how our Social Security income can be maximized. We know the struggles to create lifetime income. Seek to plan for tax-free income. Build Medicare planning that is affordable. Learn about long-term care planning that doesn't drain the savings accounts when a crisis happens. Have our wills and trusts current, so our family has our desires and not have the states make decisions. If you found value in today's show, please hit like, subscribe to our channel, and share this program with a neighbor or friend. Together, we'll keep the conversation honest and helpful for years to come. Thanks for tuning in, and we'll see you next time on Talking Turning 65.